the pitch and the roll. So again, I won't, Nancy, I think you're unmuted. I won't get too in depth, but how do I fix this one with my roll? Does this patient need to be rolled up on the left side or rolled up on the right side?
Rolled up on the left.
All right.
And laterally to the right.
Well, that's pretty good, but I still have a little bit of an error here. So what do I need to do?
You need to bring the vert down, yeah, once you rotate.
Well, look at this here. Why do I have such a difference in my body, the anatomy on that side?
You need to move laterally left.
You think laterally is going to fix that error? Let me do it.
No, it's not.
No. To the left, to the other side.
It's a roll.
Oh, no, too much. Stop. And then, well, you still need to do maybe a little bit of rotation.
Which side?
To the left side.
A roll.
No, the other left, yes.
That's this one. So now we've made this perfect. I love it. But what's happening here?
Can you switch it?
You're going to have to oh, back and forth?
Yeah. No, that's not pretty. You still need your.
I mean, that's a shoulder issue.
You think it's shoulder? All right, so then let's look at this here. If what can I do here?
You rotated.
What can I do here?
You can either rotate or you can go inside the room and do it to the patient.
You need to go inferior.
Okay, so now look at my ribs. Can y'all see my cursor? Look at my ribs here. What's happening here?
Rotation.
Right. So now we still have our issue, right? How do I fix that? Halfway maybe instead of making it perfect?
Mm-hmm.
Getting closer or no?
Yes.
What do you want me to do? I'll make it perfect.
You split both sides.
Is it in and out? Yep.
No, okay, that's good for the in and out. Can you switch it? Because I can't. Because you still rotate a little bit.
I heard somebody say that that it's the arms. So take a look at the original. Do we see the arm placement? And what are those called?
Humeral heads.
All right, so look at them there. What's happening here?
And today you're a little lower.
Oh, I'm gonna agree that part of it was the arm placement, but even if the arm placement's bad, how do we make this a little bit better of a match?
Well, if we're treating the right, then in clinic, what I would do is split the difference, but closer on the affected side and not the contralateral
right
side.
Here. This is our tumor. This is our ISO. would you fix it? And whoever came in later, which view can I move the in?
You said which view can you move what in?
The pitch,
Sagittal.
sagittal view. The pitch can be moved in the sagittal view. Can we see it?
Yes. Yes, I see it.
All right, and then which view can I move yaw? And no, Diego or Kelly, don't answer. Y'all were already in that conversation. So which one can I move yaw? And what is yaw?
Is yaw where it's like tipping side to side laterally?
Yaw is the couch rotation.
Okay.
All right.
That
so
would
yaw.
be. I'm sorry. Go ahead.
No, you're good. Tell me.
I think that would be in the coronal view.
Yep, and watch it. You see it moving? Look at the numbers under couch rotation. With me moving it, do you see I'm in the coronal view? And do you see that couch rotation moving?
Yes, I see it.
All right. And so then in the transverse view, which one am I moving?
That would be the roll.
The roll. All right. So those, again, are super, super important to memorize, to know which one moves what. And then in addition to that, for the board exam, they are going to ask you, if you've got this image, and let's say it's a breast, how do I fix it? So if it's got too much lungs, if it's got not enough lungs, if they're rolled, how do I fix it? You're going to have to be able to look at a specific plan, case, whatever you want to call it, and say, if I drop the table and then I move the table to the right, or drop the table and move it to the left, depending on which breast we're treating. Make sure you guys know that. Do you want to do it one more time on here, or is that good?
I think we're fine when it comes to that.
What else in anatomy can we help with? And I do want to tell you guys, it didn't work today, obviously. I don't know why. We all did this the other day. Me and all the instructors logged in, and I was able to give each of them access. I need to figure out why it's not happening for you guys. But any of you that want to schedule some time to log into this computer and play with it, you're more than welcome to. You'll have full access to the computer if it's working right, for you to actually do the image matching and to look at the anatomy and everything. So your clinical coordinator will coordinate the times, because I'm the one that I do have access to it. So whoever wants to do it is more than welcome. But what can I show you today before we end this? Anything?
I would say like the skull for me, at least for CBCT, like a coronal view of that would be nice. Not the corona view, I'm so sorry, the transverse view. Mainly.
Why we don't have a CBCT, we're gonna just look at a plan of a head and neck. You want to do VMAT or IMRT?
VMAT would be preferably, since we mainly use.
You'll see how what it's going to do is scroll through and show you these small images of it, but that's the top of the scan.
Okay.
What part of the the brain, and let me show you this real quick first. Are you looking more so for image matching here, or are you looking more so for actual soft tissue?
Actual soft tissue, correct?
Okay. So if any of you guys want to image match, again, just set up some time. Like if you're struggling with image matching, set up some time and you guys can match this part yourself. But the soft tissue, there's got to be a better way, and I'm going to have to find out the better way, but what are we looking at here?
The eyes right there?
Yeah, but more importantly than just eyes, you want to make sure that you can identify the optic nerve, that you can identify the lens, that you can, and not only identifying those, but also what are the CD55s for them. And then a question that I did ask somebody on the discussion post this week was, normally we have standard, not IMRT, but standard whole brain fields, right? So that standard whole brain is going to be a 90 and a 270, okay? Now, if I want to get off the optic nerve, where do I change my gantry angles to? So think of it in terms of here. Can I draw on this? I don't think I can. Anyway, so if I have a standard 90 and 270, if I want to avoid these optic nerves, how can I do that? If I pull my gantry rotation down by 3 to 5 degrees, I'm going to shoot straight through the optic nerve, right? But let's say I bring my gantry up slightly, just slightly, right? Then this beam is going to avoid some of that, because that optic nerve is right behind my eye, right? So it's going to avoid it a little bit, and the same for this one, I can avoid it a little bit. So the answer to that question would be 3 to 5 degrees anterior, right? Does that make sense?
Yes.
Okay, so sinuses are important too. I do know that you guys are probably going to get a question, whether it's maxillary, whether it's frontal, you're going to get some sort of image, and you're going to have to identify sinuses. The brainstem, the brainstem on here, this it?
No, isn't it?
Yeah.
Side here.
That's brainstem.
You think that's brainstem? And that one is super. I'm trying to find a thing for you guys in your book so you can go back to it. You know that first book we used to use, the sectional anatomy book? Y'all never had the actual book of it. You had the ebook version. You still have access to that. And the brain is chapter 3. But I do anticipate us getting, I'm going to show you a picture in a second.
Dean Allen, we don't have access to those books anymore.
You do. You still do.
When I open my library, most of the books are gone by now.
Those were forever books. They weren't a time frame type book. But if not, just request access again. So any of your books, you would have wanted to keep them for this type study, but I'll post. You don't necessarily need the book, but you do need to know where the pond is, and you need to know brainstem. You need to know optic nerve, pond, brainstem, optic nerve. You're being tested on the pituitary gland. I think that's it.
Wait, I just want to confirm, you said optic nerves, brainstem, pituitary gland, sinus, and
Sinuses.
maxillary.
Well, any of the sinuses, not just the maxillary, but any, I don't know what sinus you'll be tested on, but you will be tested on one of the sinuses.
So all sinuses, got it.
Yeah, I would just run through them, because those are pretty easy.
Okay, thank you.
And pituitary,
Yep, I got that.
pons,
Pond, oh, okay, that I don't have. Thank you.
yes. All right, so let's keep going through this one. I don't have so I think what I have pulled up right now, just so you guys realize, the reason it doesn't have the brain structures is because I have a head and neck pulled up. I think we're treating probably a larynx for this case or something. Where's our PCV? Anyway, we can see the parotid, we can see mandible, and then the mandible they are testing you guys on is the ramen of the mandible. All right, and then what's this structure? And we can bring our CT down to it too. Where am I at? What's this over here?
Carotid,
Yeah. What's this?
spinal cord.
Cord.
Yeah. All right, and then this part, and then we'll see if we can. What is this?
Isn't that the pond area?
We're way down. We're down in the throat now.
Like your larynx.
That's your larynx. Yeah, and I think you're getting tested on. Well, I know you're getting tested on the larynx, and you're getting tested on wedges. Something in the head and neck where if you needed to use wedges, which way would the heel point and which way would the toe point? Yeah, both of those are definitely. I think there could be one with, I think I put it on my final, where it's a head and neck, or like it's something around the nose, and which way would our toes point, which way would our heels point? And heels are always together, right? You'd never have a flipped one where you have a heel touching a toe, right? They're always going to be pointed in the same direction. I think some students got thrown off by that from what I've understood from the students that I've talked to. But okay, then as we continue to go down, I think what structures, roles do you
yours?
For me, it was mainly just the brain anatomy itself that had some trouble, some abdomen. But I think once you went over the difference between the spleen and the pancreas, I feel like a lot of students, well, for me, I got confused. But
A lot of people do.
yeah,
A lot of students get that confused.
this past week I was just honestly just looking over images, just practice but now I feel much more comfortable with the abdomen views, with abdomen, but mainly
And then also make sure that the female pelvis, that we can find cervix, that we can find, I forget, like right at this exact moment, I can't tell you exactly which one, but uterus, cervix, knowing the spread of lymph nodes, where it goes first, all of that you're going to be tested on for the board.
Are they gonna ask us specific lymph nodes as well as matching, like, oh, which lymph node is going to be like?
Yeah, it's gonna be specific, and it's gonna say, like, for a prostate, which lymph node does it spread to first?
Okay, all right, perfect.
So we do need to know, and there's a, you guys, if you follow Laura Naffy, she posted a really clear, clean one that says exactly what the spread goes to first for each of the anatomy. She posted that on her page. I highly suggest, if you're not following her, that you start as you're taking your boards, because she goes over, she works with so many students who are taking their boards, so she has a good idea of not what's on the exam, but how the questions are being asked, all right? So she's a good resource to use. And then there's a couple, I think that we've been sharing a couple anatomy sites with you guys to use, so use those if you're practicing. eContour is still the best one, because it contours the site for you, the exact sites that we're treating. So if you want to look at a uterus, if you want to look at a cervix, you can go on there, you can turn your structures on, and you can see everything that are organs at risk for specific plans. That's what we're going to be tested on for the board exam and for my final. But we'll continue. I want to get a better work through for Vert for you guys to use it. But at this point where you guys are at, I don't know if image matching is the most important for you, but I do know these small things that students didn't learn along the way, like what is y'all, which plane can we move y'all in, where can we move, like those simple things will take you from a 73 to a 78 on your board exam, a fail to a pass. So these little pieces are what kind of helps to put all this stuff together. And over the next few weeks, when you guys are working on that project, you'll really get into details of what moves what lasers move what. All of that stuff is what helps to bring the board exam, like, more clarity to the board exam. So we're going to be working a lot for the next few weeks on this stuff. If you ever need this system to clarify something, because you can look at lasers and everything on it as well. If you take a look down here, you can look at your lasers and see your ISO. You can look at your SSD, so you can see that. I'd have to put the body on the patient real quick. But you can actually read your SSD. You can see that if we move the table up, my SSD is getting smaller. If we move it down, my SSD is moving. So there's a lot. You can also see the field that we're actually treating. I don't think that's the actual planned field. I think that's the open.
I hope so.
Yeah, right? Okay, now that's a little better. There's the actual field. So you can, there's a lot that you guys can do with the system, but at this point, we just gotta bring everything together and make it make sense so that we can pass the board. That's our most important focus right now. All right, what else can I do for you guys?
Yes, the meeting with you, for the midterm meeting, the link, when we clicked on it, the calendar is full.
It is full now. Yeah, because there's a bunch of you guys, and all the spots are taken for Thursday. So I'll let you know. I'll open up a couple more spots, but I can't jam pack it because we're going to be going over it. And that gives every student 30 minutes to discuss that midterm and a plan forward. So if you don't get to do it on Thursday, then I'll open up some time for potentially next Tuesday.
Sounds good.
But I'll see. Let me see if we can open up a couple other spots, and then I'll for those of you who didn't get a chance to schedule it, I'll send out a message. Anything else?
I do have a question. This is in regards to like the class itself. I've overheard a couple therapists say that they're mandatory therapists to take the boards every 10 years. Is that like true?
True. That is true. You guys all fall within that 10-year range. That changed in like 2011 or something. Like I don't have to retake my boards ever again, thank God. But you guys definitely fall within that. Every 10 years you have to retake it. And the thing with that is you retake it, but it's not a pass-fail. It's not like you lose your license. If you were to struggle in an area, they're going to make you do extra CQRs to build yourself up in that specific topic.
Okay.
But actually, Veronica is about to retake hers. She falls within that range. So, yeah, she is taking hers within this, like in the next couple weeks.
Wow. Okay, so I need to actually message her and
Talk
see how
to
she's
her.
studying. Yeah, I wanted to
Yeah,
see.
talk to her and see what that test is like. Don't talk to me because I'll never take my board. But I'm pretty confident that I'd score pretty high on my board exam.
I'm pretty sure as well.
I'm pretty sure that I would score higher than I did 18 years ago.
But it's been pretty good though.
Huh?
Other than that, I feel like we're pretty good for today.
Yeah, no, I good. I think this technology is good for you guys. I think that we can also look at some deviations because that does throw students off. We can do that in here over the next couple of weeks. There are stuff, but let's, if you guys don't mind, send me a list of the stuff that you want to go over ahead of time so that I can come up with a real plan before we get on these live sessions. Like what areas you struggle DVH, or if it's with whatever it's with, then I can come up with an actual lesson plan to give us a focus. But have a great day. I am happy with the midterms, but as you guys see, there's still a lot of work to be done to make sure that we're where we need to be in the next 6 weeks.
Okay, perfect. Thank you so much.
You're welcome, guys. Have a great day.
You as well.
Thank you.
Thank
Bye.
you.
Bye.
Thank you.
Thank you very much.
Bye.